Welcome to this explainer on the mental health impact of Peyronie's disease. Let's treat our time today not just as a presentation, but as a frank, private conversation behind closed doors. We really need to create a safe space here to talk about something that way too many men suffer through in complete secrecy.
I want to start by addressing the silent struggle you might be carrying right now. If you are feeling anxious, depressed, or embarrassed because of Peyronie's disease, you need to know this. You are not alone. It is incredibly common to carry a heavy emotional weight when dealing with this. The fear, the frustration, the feeling that your body has somehow betrayed you, those are all completely natural reactions to a really difficult situation.
And to show you just how normal those feelings are, let's look at the numbers. According to Yale Medicine, up to 50% of men with this condition experience emotional distress or depression. Let that sink in. Half of all guys dealing with this are fighting a mental and emotional battle right alongside the physical one. And it makes sense, right? It's due to sudden physical changes in your body and the very real intimacy challenges that follow. When something so fundamental to your self-image changes, it takes a massive toll. Your distress is completely valid.
Okay, the physical reality. What is actually happening? We need to look at the physical facts to help strip away the stigma and shame you might be carrying around. The medical reality tells a completely different story than what your mind might be telling you.
Let's break down the plain English medical definition. Peyronie's disease is a benign, physical wound healing condition. Basically what happens is that scar tissue, which we often call plaque, forms in the elastic membrane of the penis, known as the tunica albuginea. This usually happens after micro-injuries. We're talking about things as simple as a minor bump during sports or during intimacy that you probably didn't even notice at the time. But instead of healing normally, the body overreacts. It builds up this tough scar tissue. And because scar tissue isn't elastic, it causes a curve or a bend during an erection. It is literally just a mechanical, physical wound healing abnormality. It's not cancer, it's not contagious, and please hear me on this, it is certainly not a personal failing.
I think this brilliantly illustrates the difference between your feelings and the objective medical reality. On one hand, we see what it feels like, right? Like a personal failing or a loss of your manhood. But contrast that with what it actually is. Simply a benign physical buildup of scar tissue. Your body just got a little confused during the healing process. That is the whole shebang. By separating how we feel from what is biologically happening, we can start to strip away that embarrassment and actually focus on getting you better.
Let's move on to the mental health toll, the hidden fallout. Because for a lot of guys, the psychological burden of Peyronie's disease is fought entirely in the mind, and honestly, it's often much more painful than the physical curve itself.
Looking at this documented list of emotional impacts from the Cleveland Clinic, you'll see right away that your struggles are valid medical facts. Men routinely experience depression, anxiety, or body dysmorphic disorder, which is basically focusing unfairly on your physical appearance. If you've felt deep feelings of shame, a crushing drop in self-esteem, or a really profound fear of rejection or intimacy, listen, you are not crazy and you are not broken. You are simply experiencing the well-documented mental health toll of a highly frustrating physical condition.
I want to read this quote from the Urology Care Foundation, because as a doctor, it honestly breaks my heart. Unfortunately, many men with Peyronie's disease are embarrassed and choose to suffer in silence rather than get help. This highlights just how incredibly common this isolation really is. But you do not have to hide your distress anymore. Suffering in silence only gives the anxiety and the depression room to grow. Bringing it out into the light, that's the very first step toward healing.
And the data clearly shows a measurable increase in clinical depression for men dealing with this disease. If you look at men without Peyronie's, the depression rate sits around 14%. But with Peyronie's, that jumps to almost 20%. This proves the mental toll is incredibly real and statistically significant. It is not just in your head. It is a widely recognized side effect of the disease itself.
All right, taking back control, your path forward. Because you absolutely do not have to live in the shadows. The transition from feeling helpless to feeling empowered starts the exact moment you decide to take back control of your physical and mental well-being.
I want to guide you through 3 highly manageable steps to regain control over both your physical condition and your mental well-being. Now, these aren't overnight fixes, but they are proven, effective paths forward. Step 1, see a urologist. Step 2, talk to your partner. And Step 3, consider a therapist. Let's break down exactly why each of these is so absolutely crucial. First, why urologic support matters. Seeing a urologist opens the door to safe, evidence-based treatments. First and foremost, you get an accurate medical diagnosis. No more guessing, no more spiraling down internet rabbit holes. From there, we can discuss non-surgical treatments, things like specific medications or gentle mechanical traction therapies. Or, if your curve has been stable for a while, we can actually explore surgical options to correct the shape. But above all, a urologist helps prevent the condition from worsening. And I have to strongly emphasize this. Please avoid any unsafe self-treatment. Rely on medical professionals to guide your physical care safely.
Next, we have to talk about the power of open communication. The medical advice here is crystal clear. Communicating with your partner and seeking psychological counseling are just as vital as treating the physical curve itself. You have to be honest with your partner. Hiding this only creates a wall between you and causes totally unnecessary relationship stress. Furthermore, consulting a certified sex therapist can give you some amazing, practical tools to navigate intimacy barriers while you're undergoing physical treatment. And finally, speaking to a psychiatrist or a counselor to manage anxiety and depression is a crucial part of your overall healthcare plan. You really have to treat your mind with the same urgency as your body.
Okay, summary and next steps. Let's wrap up this explainer by recapping the absolute most important things I want you to remember from our conversation today.
Here is the core message. First, you are not alone. Estimates suggest up to 1 in 10 men are affected by this at some point. Second, remember that it is a physical, treatable, wound-healing condition. It's a mechanical issue, not a reflection of your worth or your manhood. Third, your mental health symptoms, the anxiety, the depression, they are completely valid and highly common. And finally, both urologic and psychological support are readily available. You literally just have to reach out and ask for it.
I want to leave you with this final thought. Are you ready to step out of the silence and take back control of your health? The shadows are a really lonely place to live, and you for sure don't have to stay there. I encourage you to spark your courage, pick up the phone, schedule an appointment with a specialist, and start your journey back to feeling like yourself again.
If you'd like to learn more, click the link in the description below.